Hi, this is Dr. Mike Jurgelewicz, functional medicine practitioner, and I wanted to spend a few moments and explain to you about how I got into functional medicine and my story. So, back when I was getting out of undergrad at Penn State University, I moved back to the Bucks County area, but I was living in Center City, Philadelphia, and I started to develop some of these symptoms. The first was this dry chronic cough that I couldn't kick, as well as I was breaking out in a lot of hives. And this was something that I couldn't really tie to any changes in different products and things that I was using or anything in the environment. But I went to Penn's Asthma Center at Broad Street in Center City, and at the time I was diagnosed with asthma, and they put me on medications like Allegra and Zyrtec to help with the hives, and Advair and Flovent for the asthma. And so for me, I didn't really understand, how I went the first 21 years of my life without asthma, and then all of a sudden I developed asthma all of a sudden. So I wasn't really looking at it as like I have this chronic disease now. It was more of how is my immune system not functioning normally. And at the same time, I was told by the doctors that I had positive antibodies for hypothyroidism, but you don't have hypothyroidism. So at the time, these medications were helping with the hives, but not really the chronic cough. So then they put me on a few other medications, and finally they landed on QVAR, which gets a little bit deeper in the airway, and it was able to help me from like a disease maintenance and symptom management perspective. And then when I went to a few years later, when I was coming out of graduate school, that's when I started to look at um, everything more in this functional medicine lens. And I was remembering back in 2001, this is when I had these positive antibodies for hypothyroidism. So I went to a primary care doctor in Newtown, and they ran some traditional laboratory testing, relatively limited. And I was told when I showed up there that everything was normal. And then when I looked at my thyroid markers, my T3 was low. So I said, well, what about the T3? And they said, well, you appear to be fit and healthy. So at that moment in time, I knew I kind of really had to take control of my own health. So and I realized that I had the previous antibodies for thyroid, and I also had some of these issues with lower T3. So as I went down this rabbit hole a little bit, I retested the antibodies and they were positive, and my vitamin D levels were low. And obviously, with the T3 being low, that's more of a cofactor nutrient deficiency with that conversion of T4 to T3. I had some GI issues and some gluten sensitivities, as well as other food sensitivities and intestinal barrier dysfunction. And so, what happens is when you have these antibodies to, to a certain tissue, it's essentially tagging the tissue for future destruction. And these antibodies will show up in your body for 7 to 10 years before a clinical diagnosis. So I was kind of in that range of I didn't really have a diagnosis yet, but I was having this immune dysfunction. So what we did is we addressed those underlying factors that contribute to autoimmunity that were unique to me, and I essentially was able to kind of shut off that process. And it never really turned into affecting my TSH levels or having that thyroid issue. So I've been gluten free for probably the last 12 years, and I do a lot of the same stuff that I do for a lot of my patients. And I also got really entrenched into the autoimmune conditions is because my grandmother was diagnosed with rheumatoid arthritis, my dad was diagnosed with rheumatoid arthritis, and so I was able to really help other family members with autoimmunity. And this just happens to be one of those areas that kind of slips through the cracks of traditional medicine, because the traditional medicine model is essentially going to just not really address those environmental factors or the diet, lifestyle, or nutritional therapeutics, but really just how can we suppress this overactive immune system? And sure, if someone's in a crisis, it's good, but realistically, when someone has this chronic issue, their healthcare practitioner is not telling the individual that they can change the trajectory of their condition or their issue with lifestyle, diet, or nutritional therapeutics.